Hi, Dr. Baumholtz, Baumholtz Plastic Surgery, and this is the next video in the series about Baumholtz Talks Botched, Baumholtz Talks Botched. How about that? Gotta get through the sentence. Where we delve into the topic of what is perceived or popularly called botched plastic surgery. We've already talked about what the definition of that might be, meaning either an unhappy patient or an unfavorable outcome or buyer's remorse or just expectations that were not in keeping with what was reasonable. Today we're going to talk about the surgeon factors that go into sort of limiting or mitigating botched surgery or surgery that involves any of those characteristics. If you see me looking down, it's because I've got some notes, and I want to make sure that we copy or tackle these topics. All right, so first and foremost, of course, let's talk about the surgical factors or the surgeon factors, and those are you want to go to a board-certified plastic surgeon. Now, typically in the first year following completion of training, right, a surgeon is not board certified. That doesn't make them a bad surgeon, doesn't mean that's someone you shouldn't go to. Certainly my first year of practice, I was not board certified. I was board certified in general surgery at the time, but I was not board certified in plastic surgery. And the reason for that is because part of the American Board of Plastic Surgery's certification process is it collects the work you do in your first year, and that becomes the basis, or part of the basis at least, for your examination in plastic surgery. So you make sure that someone is either going to become a board-certified plastic surgeon, which is completely different than folks who are calling themselves board-certified cosmetic surgeons. So a cosmetic surgeon, by definition, is not the same thing as a plastic surgeon. Their training is I don't even want to comment on that right now, but it is not the breadth and depth of plastic surgery. So my recommendations to you is we want you to go to someone that is board certified by the American Board of Plastic Surgery, or they're in their collection period for the American Board of Plastic Surgery. Once they've completed their plastic surgery certification, they'll be eligible to become members of the major societies, ASPS, the American Society of Plastic Surgery, and then there's the Aesthetic Society, which is typically offered as a possible membership route a little bit later. So someone that is board certified, a member of both ASPS and ASAPS, generally you're going to be off to a great start. Next, people often ask me, how many of a given procedure have I done? My response invariably is, how many do you think I need to do to be competent at this? And so the answer would surprise a lot of people. Plastic surgery is a discipline of procedures and techniques, not so much, is a discipline of techniques, not so much the procedures. So again, we learn techniques, whereas maybe I'm going to pick on my orthopedic colleagues or my, even when I was a general surgeon, there's only so many ways to do a gallbladder, there's only so many ways to do a broken wrist. At the end of the day, what plastic surgeons are particularly gifted at is you look at a problem and you break it into its smaller pieces, and even if you haven't done the entire problem before, you've definitely done those different pieces. So I think a better question to ask the surgeon is, are you comfortable doing this case? A immediate corollary to that question is, have you managed the complications that are associated with doing this particular procedure? Because it's one thing to go try to do a procedure that you may not have done. That's actually okay. We just talked about why. But are you comfortable and competent managing the complications? I will say over and over again, the only surgeons that don't have complications lie, or they don't do enough surgery. So all surgeons have the capacity to have a complication, and all surgeries have the capacity to have risk. Okay, so then other ways to look at your surgery or surgeon-related factors are look at the reviews. What are other people saying about that particular surgeon? Take it with a grain of salt, both the ones at the high end and the low end, but sort of look at what the average feel is about this surgeon. Of course, it has to do with your interaction and your feeling with that surgeon at that time. The most important thing I think I do with my patients when they come to see me is I manage expectations, right? So that a successful outcome for me in my practice is where the patient and I are traveling along sort of the same pathway with the same end goal in mind, and we have reasonable expectations about what the surgery can do for them in their body, with their genetics and their healing capabilities and their skin type, and whether they're they've got medical issues or not, and all of those factors that go into being a good doctor and a good surgeon and maximizing the benefit for the patient, so that we have good, reasonable expectations. that is an overview of the surgeon factors that go into mitigating or decreasing what we might consider as botched plastic surgery. Stay tuned. There'll be some upcoming videos where we're going to talk about patient factors, we're going to talk about facility factors, and then we'll get into some more details, some more specific stories. Have an awesome day.